live. We're going to do a Q&A with Ubiquitech UBQU that has not made any type of noise in quite a long time, but there is a new engine in this vehicle, and we're going to find out firsthand what that is and what to expect from the ticker symbol UBQU. Everybody, we are not licensed brokers. We are not financial planners. We don't have any right to tell you how to invest. Do your own due diligence. Make sure that you know what you own, and we're only here to bring information to you and allow you to make an intelligent decision on your own with your licensed broker. All right, Kevin, are you on? You got to click the microphone to unmute yourself so you can talk, just so you know.
You know, the three most used words online is "you are on mute." Maybe that's 4 words. But, you know,
you're muted.
A few facial expression, or you're on mute. So, anyway, I'm here.
Well, you're live. Welcome.
Well, all right, great. Thank you very much. I look forward to getting into this with you guys.
Everybody that's in the room now, if you would, go ahead and share this space. Let people know that we're starting now, and they want to hear what Innovative Outcomes has to say about the new UBQU. All right, give everybody a second to share that before we get going. All right, we're filling up. Well, I'm excited. Yeah, this is an old ticker symbol we haven't heard in quite a while. So when you connected with me to do a Q&A, I was more than welcome to do that. And I'm glad to know you, Kevin.
Yeah, well, it's exciting for me to talk about it. You know, you've been in the space. I've been in the space for a long time, and you can't tell your story enough. You know, and if you can't tell your story, nobody else can. That's for sure. So I'm anxious and interested and ready to tell you what we do.
All right. Well, I think let's get this going, and people will join as they go. And again, this is going to be a live recording. We're going to create a replay and you create a YouTube video out of it. So everybody that is listening late or can't make it, don't worry about it. You'll have a chance to listen in live and hear everything that has to be said. So let's do this. All right, Kevin, if you could introduce yourself real quick to everybody and let them know who you are, if you would.
Sure. I'm Kevin Lamb. I'm the CEO of Innovative Outcomes. We're located in Little Rock, Arkansas. I've been in the wound care space for about 25 years, been in the healthcare space since '86, probably longer than some of you guys have been alive. Seen a lot of changes, but yeah, just, you know, that's me in a nutshell. Family, 6 children, married, just celebrated our 42nd anniversary.
Congratulations, man.
My wife's chief operations officer. She's the one. It's funny, most people don't even know we're married when they come to work here, because we rarely interact with each other. You know, chief operations and compliance, and what I do is far ends of the spectrum. So, but she's excellent at what she does, and we've worked together for a long time.
Well, can you tell us a little bit about your experience and background in the industry?
Sure. Yeah, I entered the healthcare space, like I said, in 1986 with various product offerings, all billed to third-party reimbursement, Medicare, Medicaid, commercial insurance plans. I'd worked in the enteral feeding, and for those who don't know what enteral feeding is, it's tube feeding or nutrition for patients that have had strokes, CVAs. They have an inability to swallow. And then I broke into the pain management sector when it became kind of a cool space to be in. Had a good friend that was an anesthesiologist that was explaining to me that a lot of patients were being discharged from the hospital relatively quickly after surgery, and the number one reason they didn't get discharged was because of pain management. And so we got into the pain management pump rental business, not insurance side of it, but renting to hospitals and just a variety of different, I guess, specialties that would manage pain. And then we got into the pain management, and all this is relevant. We got into the pain management kit business. So when an anesthesiologist would use a spinal tray or an epidural tray to do a differential nerve block or a spinal nerve block or whatever, we would package that tray, sterilize it, customize it for that particular practice type and that doctor, and deliver it to their hospital or to their clinic to use on patients. And that kind of got me interested in the pain management. From the pain management side into the wound care. When I first got into the business, I thought that wounds actually hurt. And come to find out that wounds didn't really hurt. They were very much neuropathic, which means that the nerves are very muted, if you will, and primarily driven by the diabetic population, or it was at that point, and it still is. So I found it fascinating that pain management had no play in wound care, but the treatment of the topical wound on a patient's skin was becoming a huge problem. So in 2000, a bill that was signed in 96 kind of eliminated a lot of home health agencies around the country because of reimbursement, and patients were left to find their own, I guess, their own ability. They had to find their own supplies for wound care. So wound centers began to pop up around the country, and that was really surgeons or podiatrists that had a kind of a subspecialty of wound care, revascularization of the lower extremity, et cetera. And we started working with those guys and found that there was a tremendous amount of supplies needed for the patient at home. And during this period, insurance began to change the way they reimbursed. You had lump sums being paid for paid to hospitals and various specialties that was to pay for all supplies being used in the hospital setting. Well, so hospitals would discharge patients as fast as they could. And again, pain management and wound care were the two ancillary supply regimens that needed at home. And we picked the wound care space, and we found that it was an underserved market, that the population
Yep.
was in their mid to late 70s, and they were having trouble finding supplies. So we made ourselves available to clinicians to write prescriptions, send them to us, and we sent it to the patients and built their insurance. So it's very much like I did back in the 80s and early 90s, but with the specialty of wound care. So that's kind of how I got into the business. And like I said, I've been in it 25 years. So it's we love it. We love the space and like the solutions that we provide to patients.
It's hard not to recognize some of the deficits when you're in that niche of business. When you're in the hospital, for instance, I mean, you can almost sit and notice some of the areas that really can use a little bit of work. So I'm happy that you're filling a demand that was desperately needed in that area.
Well, thanks. We didn't have any idea, frankly, in 2000 that the diabetes population, then it was about 14 million in the U.S., would
It's
mushroom
blown
into
up.
30. That's 30 million. I mean, you know, I think you've got an affection or affiliation with someone in the space, but diabetes is a
My
driver
wife
of
is
wound.
a
Yeah.
diabetic. Yeah, is wow. The moment my doctor told me I was pre-diabetic, she told them no medication. She was going to change my entire diet. She went through a lot of painstaking effort to get my weight down, my A1C down, because she was bound and determined for me to never be on metformin and end up on dialysis.
Well,
It's a horrible road to go down.
well, it is, and the tragedy is that we don't view diabetes as a huge driver in the cost of our healthcare space, but it is a huge driver, not only from the dialysis side, but the wound care and the amputation side of the. I mean, it's horrific, and we're seeing 30 million right now, 30 million diagnosed diabetics in the market. And I was talking to a pediatrician the other day that was telling me that when he was in practice back in the 70s and 80s, that he'd see one, maybe two, three patients in his career with diabetes in the pediatric world, and now they're charting. They'll see three a day. It's one in three
Oh yeah.
patients, their pediatric patients, are diabetic or pre-diabetic. So it's a tidal wave that's coming, and the symptoms are the obvious symptoms, but the tragedy is it typically turns in about 25 to 35% of all patients end up having a wound. And of those patients, 50% have recurring wounds. And when you look at the population of 30 million, we estimate, and the markets estimate, there's about 8 million wound care patients in the US that are diagnosed and ultimately should be seeking treatment.
Yeah, it's getting a little out of hand. Well, before we get into what innovative outcomes is, have you built a business like this before?
I have. We started a company in 2000, literally the old adage, on a credit card and hope. And we built it to roughly 40 million top line revenue, all organic growth, just through the market maturation, regulatory environment, embracing that this was a good thing for patients to be able to receive supplies at home. We grew it to about 40 million, and in 2014-15, it's a little gray on the actual date, but we sold the company to private equity, and really stayed in the business for about 3 years. And after 3 years, decided to leave the company. They should have had it by then. They should be operating successfully and had the team in place. But we left in 2018, and then I recognized that I just wasn't finished. That I was talking to you the other day that I felt like I could do something else, but when I got out into the market, nothing interested me in healthcare or otherwise. So I know a lot about wound care, and this is where my friends are, and I know that patients deserve better, and we didn't see better happening. We saw a tremendous consolidation of companies that were basically shorting or shrinking their offering, if you will, not in the number of products that they had, but their response to the patients and response to clinics. And we just felt like there was something more is needed. So when we sold the other company, we took a couple of years and decided what we wanted to do. I did some consulting in the wound care space for some clinics and some companies, and ultimately landed back starting another company like we had before. And the private equity decided that they didn't want to be in the wound care business after about 3 years after our exit, and they closed that entity. And so it was a perfect time for us to get back into it without any threat of, that we were trying to muscle into the market that we had sold previously. So that was my previous experience, and we're ready to do it again. But this time we're not going to build it for 40 million. We believe we can get 100, 150, 200 million in the next 3 to 5 years. The reason it took us 10 or 12 years to build the first one was when we first got into the space, we had a lot of clinics that felt like that they could give product away better than we could supply the patient. And they started realizing reimbursement was killing them, and they were having a tough time with the cost of supplies. So now that's all gone. Back then it was trying to talk them into sending us an order. Now it's trying to squeeze in a lunch date. I mean, it's gotten to the point where there's a lot of companies that do what we do, but not like we do it. So we feel like we've differentiated the space tremendously. So that answers your question.
That's awesome.
That's kind of the overview. Yeah.
So your current company, Innovative Outcomes Inc., what kind of revenues are you currently producing last year and this year so far?
Well, last year we generated roughly 5 million in top line, and that was kind of our first year of building. We hit a little bit of a critical mass going forward because we matured some of our clinics. At the beginning of the year, there's a tendency for it to be slower than the second half. The second half of the year is where the growth happens. First half of the year, patients, and everyone will identify this, where they've got deductibles that they've got to meet. Patients put off going to the doctor because they know they're going to have to pay their 20, 40, 60% deductible that the insurance company has imposed on them. So they delay going to see the doctor. Well, what that does is it creates a bigger wound problem second and third quarter, because they put off seeing the doctor, so the wounds that they put off treatment
gets worse.
Have got much bigger. Just what we saw in COVID. I mean, we're still seeing COVID wounds. Patients that didn't see the doctor for 2 years now are they're pre-amputation.
Well, they're kind of scared too.
Oh yeah, I would be if I had a big ugly wound on my foot and I knew that the conversation was going to be amputation. Nobody wants that. So. But we anticipate this year far exceeding what we did last year and ramping with some real momentum going into 25.
Now, you talked to me privately about something that I would love. I don't see it in what we're going to speak about today. So could you address with people the care and concern you add on just not only supplying the product, but helping educate and keep the patients in line with how to do it? Yeah, I think that takes you're taking this to another level.
Well, it differentiates us. And, in our space, just like a mail order pharmacy. So if you look at what we do, we get a prescription from a doctor. It comes out via fax. Interestingly enough, that's still the method of data transmission in the healthcare space because of security and HIPAA, et cetera. But we'll get a prescription and note documentation to support the order via fax. Then we take that order and we break it into parts so that if the doctor says that they want their patient to receive product A, B, C, and D to be applied to their leg every day, we take A, B, C, and D and we put it in a unit dose package, which is really nothing more than a sealed bag It's got a perforated edge so they can easily get into it, and it's got sterile product located in it based on what the doctor told us that he wanted the patient to have. We took that a step further and we put a QR code using artificial intelligence, which is the true definition of artificial intelligence. We have a QR code on the package that, based on the prompts and the order that has been sent in and put in our system, will create a video tutorial narrated by a doctor. We have a library of videos that apply to this, and it applies the QR code to the package. So the patient can take their phone, open the camera, and QR codes now are they're very obviously easy to use. It takes them to
Yeah.
a website that we host that lives on our servers, and they can watch a video of how to apply the dressings that they had ordered for them. So dressings that you might get and dressings I might get could be different. Your video is going to be different than mine. So every package has that QR code on it. We've taken that one step further in that we want the patients to remember to change their dressings, because while I was not in wound care, we did some surveys and talked to a bunch of doctors. We found that the number one reason a patient didn't heal quickly or at all was their lack of compliance with changing their dressings. They simply forgot. And it's hard for us to understand that or believe that, but one day
No,
goes by that I'm
it
changing.
seems
Yeah,
daunting when
yeah,
don't have a background in the medical field. You've never done this, and you're in pain or dealing with something that's nasty, pussy, whatever. It's really it's like, no, my leg's fine. I don't want to take the bandage off. It'll be
right.
okay.
Well, they take it off and they see what they're dealing with, and that's the ugly part of
Uh,
it. So we send them a text. We have the capability. It's not something we cram down their throat, but we have the capability of sending them a text with the frequency of dressing changes that they have been ordered. So it'll send them a text every day. Make sure you change your dressings. Your doctor cares about you. He wants you to make sure you make your next appointment. So we not only try to keep the patients self-sufficient, but we remind them that they're not going to get better if they don't go to the doctor. They've got to see the doctor for two reasons: one, for treatment, and two, they're not going to get another order from us if they don't, because the insurance compliance. They have to see the doctor every 30 days. So we differentiate ourselves in that we're very patient centric, and we don't charge for this. This is just part of what we do. Our warehouse has trouble packaging an order if I send it down, or one of the ladies sends it down, it says bulk. They'll call upstairs and say, "Are you sure you want it bulk packed?" Because everything we package is unit dose, because 95 to 98% of the patients prefer that. So that's what differentiates us. And we believe that the patient deserve this level of artificial intelligence. I mean, it's available. We developed some of the things. We need to lean into it and make it available to them.
I do see something positive out of that. It will increase the amount of residual income coming into the company, because if you can keep them on a regular schedule, remind them to go back to their doctor, you'll be able to continue to provide your products to the patient.
Yeah,
Whereas if they don't go to the doctor, it shuts off the revenue for them purchasing the product because it won't get covered by insurance.
and it shuts off the doctor's revenue because they're not going to see him or her to seek treatment. So there is
Yep,
a revenue play, but at the end of the day, these are human beings. They deserve to get well. If they're willing to spend the time and effort to treat themselves, my goodness, who are we not to help them? So we have a
agreed,
passion for that.
agreed.
We have a passion for this business and the people that we serve.
I'm really glad you shared that. I thought that was a really interesting aspect of the company's approach. Next, where could you envision this company's revenues growth over the next 3 to 5 year time frame?
It's hard
And
to
why did you
imagine.
say 150 to 200?
Well, it's hard. The space is $3 billion space. Just the wound care supplies being sent to patients. So when you look at $3 billion and the population of patients being roughly 7 million, it can only expand. With diabetes being it's a pervasive disease. It makes COVID look like a hangnail, honestly, with the number of patients and the cost that's tied to it. So with organic growth, which we have the scalability to grow organically to reach those numbers, we also have some strategic targeted acquisition, some acquisition targets that are out there that we're reviewing and trying to make sure they fit into our profile and support. And it's not necessarily companies like us; it's a variety of things. So we believe that with all of that, we can achieve the $100 to $200 million top line revenue. That's our goal, anyway.
Excellent. What's the most explosive growth path or area for you in the near term?
Sure. We are looking at the retail space, and the reason why, and I say retail, direct to consumer space, we are taking our
Okay.
unit dose, we're taking our unit dose packaging, and we're making that available from a retail application for patients because deductibles get crazy expensive. Insurance companies in some capacity are cutting the reimbursement, so they'll pay 50 cents of what Medicare will pay. They'll pay 50 cents on the dollar in some areas. So we believe leaning into the retail side of it fills that other void because we can do it inexpensively compared to the patient trying to get their pharmacy to order product or whatever resources they go and look into. We know the quality of products. We can bring in less costly products because we understand the quality of the products that we're bringing in. We're not just going to go out and buy a generic and sell it for cheap, if you will, because that is an ingredient for disaster for the patient. We want to make sure that they get the highest quality of collagen or alginate or foam that's available at an effective price or efficient price. So we believe that that part of the space is going to grow because of the insurance. Some people have $6,500 deductibles on their Medicare replacement plans, so they're not going to get
Yeah.
anything paid for until they hit $6,500. So we don't want to miss that segment of the healthcare space. So we believe it's explosive.
So so what are some of the ways you're going to get exposure within the retail community for your products?
Sure. The one thing that we collectively in the healthcare space don't do extremely well is social media or direct to consumer marketing. So that's one of the reasons we put together the project with Ubiquitech because that is one of their strengths is direct to consumer, whether it's using television, whether it's using social media, uh, you know, these services that would, streaming services that patients or clinics can align themselves with, et cetera. So we believe that that's going to be the vehicle to expose patients to what we have to offer. That, along with the clinics that we have an intimate relationship with, we want them to have access, the patients that they serve to have access to the products as well. So we're using really multiple channels to expose patients to the opportunity to buy the product from us, whether it's direct because of a social media post or whether it's their doctor saying you need to go buy product from this company. And it's not Amazon, and nothing against Amazon, but if you go to Amazon and you type in bordered foam, which means something to us, it doesn't mean to most people, but you're going to pull up 20 brands, multiple sizes, and some with transfer agents, some with hydrophilic, some with a bacterial killing product in it. Patients have no idea what that is, and they don't know what they're buying. So some people will say, if I buy the most expensive, it's going to be best. Some will say, well, I can't afford it, so I'm going to buy the cheapest. It's going to be best. Well, we know what's best, and we can help them understand that better. But other area that's really we're seeing a lot of growth and a lot of opportunity for companies like us is dermatology in the Mohs space. A Mohs is a procedure that was developed several years ago, and it's where they take the top layer of like a skin cancer off. And we have a collagen with honey in it. Honey being a bacteriostatic where it kills bacteria in the wound.
Yeah.
They can put a collagen with honey in it and cover it with a product. And we're seeing dermatologists really become aggressive with Mohs patients. And we see that as an opportunity as well. So those are the areas: retail, accessing the retail space, and the dermatology market, which most companies like us don't really deal a lot with because they have smaller orders. They're expensive products, but they're smaller orders and fewer patients globally.
That's pretty awesome. I mean, the fact that y'all are going at an approach that covers so many different bases is going to pay off really well. How does the
Yep.
company get paid, and do you work with insurance companies, or how does that work?
You know, we get paid through, there's multiple channels: insurance, traditional, commercial. You or I would probably have an insurance plan. Medicare replacement plans, which is going to be like a Humana Gold. I call them the Joe Namath plans that you see advertised on television,
Yep.
usually in October, November, December, when people are making decisions about their next year healthcare plan. So those are Medicare replacement managed care plans. traditional Medicare, which is about 40+% of the market, Medicaid around the country, depending on the state and our ability to be in the network for that state. Some of them we don't want to be in. I'll just be honest with you, because they'll pay less than our cost, and I don't want to be bound by
It doesn't
that
make sense.
contract.
Yeah.
No, and I hate it for the patients, but it's just not good. We can't stay in business by doing that. And then there's, their private pay, where patients are paying out of pocket in order to reach their deductible, and they, are experiencing getting supplies, and they're having to pay for it until they hit deductible, and then we bill their insurance. But typically it's commercial plans, Medicare, Medicare replacement plans, Medicaid, some workman's comp, depending on that arena there, and the workman's comp company. That's not necessarily our favorite space, but we will supply patients workman's comp if we get a good pre-auth on them.
Because if it's a pre-auth, they'll cover it. Yeah.
Most of the time. But the order comes in, we verify coverage. I mean, we have an automated system that we have clerks that will click on it, and it takes them out to the sea of Medicare, sea of insurance plans, and it tells us if they have coverage, what codes are covered, if they've got certain things, like if they're in the hospital or they've got a home health agency visit that's blocking other sources of payment to us. So we verify coverage. We're not in the dark. We go at it very intelligently. And then if there's no coverage, we call the patient. So you don't have any coverage. How would you like to pursue this? Either you can pay us and try to meet your deductible. We can give you to our sister company, and you can buy it retail. So we try to cover all the bases there.
Okay. Well,
and honestly, we work with about 400 insurance companies, and we're working to get in network with the ones we believe are good in network partners, and some we don't want to be in their network because they're just not fair to the providers. But that's a hit and miss arrangement.
I think everybody on here has dealt with insurance companies and knows that there's a little bit of a racket involved. There's some you don't want to be associated with, and some you do. And if they've been through that, they understand exactly what you're saying.
Yeah.
Tell us a little bit about the employees and facilities that support your company.
Sure. We built a building here in Little Rock about, 2008. It's 20,000 square feet. We built it specifically for wound care supplies. And I know that sounds a little ridiculous, but the way our building's set up, it's really back office, sales, marketing, et cetera. And then our warehouse, and where we package all of our products. And I posted some videos and showed some warehouse shots, et cetera. But we buy all the product from manufacturers or distribution channels in boxes, like 10 to a box. Those boxes are then broken into individual products and put in the package based on the patient's dressings. Our employees, we have about 21 right now. Back in the day when we were doing a lot more business, we had a lot more employees. Some of that was sales effort, and it was just we were educating the market. Some of it was just the efficiencies pre-technology. So our technology is so advanced now, we can do nearly 5 times the work with every employee than we had back in the day, just because of our technology and our knowledge. Oh yeah, and it's just amazing how technology has reduced the requirement for manpower. We don't bring people in to develop and then cut them because we don't need them anymore because technology replaced their job. We try to educate them in the technology we're using. It's typically, artificial intelligence is way overused, as we all know, or machine learning, but our systems are built around an artificial intelligence platform and a machine learning platform, and we keep the staff well aware of how the process works. And we try to, we hit critical mass, we add people. And we've got some people that are with us that have been with us for 15 years. So they came back over, and they believe in what we do, and they believe in our effort to be in the space and make a difference with patients' lives. And they've come back on board, whether in sales area, in our back office area, and in our warehouse. So we've got all the critical areas covered. So we believe we can grow quickly. Mm-hmm.
With the amount of turnover that people have seen with their companies in recent years, I'm glad to see you're working from within your company to build people up. I mean, that goes a long ways with being able to control the quality of the products you're putting out.
Yeah, we believe so, and you're right. But it's very difficult to find people. In the past, it was hire fast and fire fast. Now
Yeah.
it's diligence when you're hiring someone, and when you make that investment, you are doing everything you can to mature them in your company, so they don't want to leave. They enjoy what they do. So we try to create a fun work environment. I mean, as fun as you can be when you're moving papers and posting orders, et cetera, and posting payments,
Right.
but it's not necessarily something I would want to do every day, but thank God we have people that do want to do that every day, and we believe in them. They do a good job. So we
Well,
believe we can double the size of our company over what we had before in short order, just based on our experience.
that leads me to a pivotal question that if you're looking at this company as an investment, um, can your employees and facilities handle explosive growth? And how are you going to deal with that when it comes to the company?
Yeah, we can. We have people that we've spoken to that are former employees that we believe we can pull back in pretty quickly. Uh, but right, our the old company was doing about 10,000 boxes, which is equivalent to about give or say 10,000 or 10,000 times 22 packages is what it turns into. About 220,000 units a month of packaging. We can hit those numbers with an addition of about 3 people in our warehouse, 3 to 4 because of our technology, because we have an automated bagging system. We have QR codes that are applied to the package automatically based on our technology. Just the way our orders are processed and the artificial intelligence that we incorporate into our systems, it's critical. It's not necessarily artificial intelligence we sell or we have others using, but we use it
You
inside
utilize
to
it.
build our business. Yeah, we use it about QR codes and packaging, et cetera. Um, we believe that we can get to 20,000 boxes a month with our warehouse and our staff with one shift. We can always go to two if we needed to. We're in a pretty dynamic community in Little Rock. There's always challenges when you start bringing in head count, but we believe we have the staff. We've had it before, and we'll get them back in, some or at least similar to those people.
That's awesome. I'm glad to hear that. I mean, that's just one of the things we do here at OTC Stock Talk is try to educate investors. So when you're looking at an investment and a company's talking about how they're going to grow, do they have the capacity to do that? And you being able to tell us that within just 3 employees being added, you can meet that high growth capacity. That's pretty strong statement right there. I mean,
Yeah,
can you tell
and
us about? Go ahead.
mhm.
Go
Go
ahead.
ahead. Yeah.
Can you tell us about the name Innovative Outcomes and how it defines the company?
Well, it's funny when we started talking about names for a company. We threw a lot of things against the wall, and the one thing that we have been is innovative. In 2017, I'm not real good at self promotion, so if I sound stupid, just forgive me. 2017, I was named as one of the top 10 medical innovators in the world by Forbes magazine. And it was because of our QR code. We were way before AI really became cool, but it was because of our QR code and our unit dose packaging and our affection for the patient and teaching patients how to take care of themselves. Because today, if you look at insurance companies, Medicare, et cetera, the entire model is built around self care. They want to discharge patients, teach the family how to take care of them, or as a home health agency, how to take care of them, and then the patient comes back to the hospital if they absolutely have to. So that's the new healthcare model across the board. We find that if you empower patients and you teach patients, you have a much better higher percentage of an positive outcome than you do if you just send them stuff and say good luck. That just doesn't work. It doesn't work in the new environment, the new healthcare industry that you and I are living in. So innovative because we do take an innovative approach to patient supply and care, and because everything we do is built around the outcome. And when you deal in the wound care space, they always talk about positive outcome, and a positive outcome is a patient that is healed. That skin has grown back together, and they're not dealing with draining on their sheets at night in bed. As disgusting as all that is, that's life. And
That's life,
we
man.
want
Yeah.
we want to get them where they are self-sufficient. We got a truck driver that's a patient. We want to make sure that he can push that clutch. He doesn't lose his left leg because of a wound that's gotten infected. He gets to
Because then he
supplies he
loses his
needs.
livelihood.
Right. And he's got two kids at home or whatever. So we look deeper into the space than I'd say 99% of the other companies in this space. Manufacturers are really good at doing, studies and the kill rates of germs and absorption rates and all those things. And those are fantastic. But if they're not put on the right kind of wound, or if they're not being utilized properly by the patient, they're worthless. When I was a kid, I rode my tricycle off the front porch of my house, busted my
Ouch.
lower lip. Yeah, busted my lower lip. And I mean, I had like 20 stitches. And on the way home, my mom was looking at me through the mirror in the back seat of the car, and I said, "Look at this!" And I had all the stitches in my hand. I had pulled every one of them out because I had these little things in my mouth,
Oh my.
and I don't remember it necessarily. And she said, "What did you do?" And I said, "I took all these pieces of, pieces of string out of my mouth." So I messed up that doctor's good work between the doctor's office and my house. So you can only imagine people that have a big egregious wound on their foot that have never been around healthcare before, how quick they can screw that up. So we want to try to give them all the tools possible so that they don't screw it up and they get better quicker. So that's kind of the reason for the name of Innovative Outcomes, and we lean into the space pretty hard. As you can tell, we've got a lot of things that differentiate us, but it should be the way everyone operates, not just
It
us.
should
So
be. It's not, but I'm glad to see you guys are doing it like that. So that leads us, okay, when you're talking about public companies, you've got this business, Innovative Outcomes. And
mhm.
being a public company, you have to be in a vehicle to be public. So why the merger into Ubiquitech Software Corp?
Yeah, good question. We looked at them, they looked at us, and we decided that because of our unique application of the artificial intelligence and the packaging and all of the things that we do relevant and related to patient care, all is not possible unless we have the consumer and or the clinician sending us the orders. We can have the best solutions in the world, but if they stay in this building, they're worthless to all. So we felt like Ubiquitech would give us a vehicle to be able to communicate to the overall market and get a bigger footprint into a larger space and make it more aware. Pharmaceutical companies have been genius at this. When you have the Manjaro and you have the Viagra model where they're teaching patients about the product and the patients go in and ask for it, the doctors write that order. So no healthcare company that I'm aware of on the supply side has ever been good at getting a patient to ask for their services. They might ask for a product, but they're not typically asking for services. So we believe that Ubiquitech has the vehicle and the horsepower and the capability of putting us in front of that consumer so we can tell our story. We can tell our own story. We just need the vehicle to get in front of them. And that's the reason we went with Ubiquitech.
Fair enough. All right. Can you talk a little bit more about your use of technology in business and more specifically AI?
Sure. Again, I think it's an overused abbreviation, and I've used it a bunch, and I apologize for that. I've already kind of said it's overused, and I've probably overused it as well. We are working with some software companies, not software. They are software companies that actually take pictures of wounds, and the pictorial of that wound will identify the measurement to give an accurate measurement. Some of them will define necrotic tissue or dead tissue that needs to be extracted out of the wound for proper healing. Biofilm, which is kind of a poison inside the system to make the wound not heal well. So we're because of our AI teaching patients, we're trying to create a better pathway so clinicians can order product, and that ordering platform could possibly even suggest products that they order, not necessarily just say you need these categories of products, but suggest products that would be applicable to that patient's condition. We also are working with, we produce film. I got in the film business back in 15 and started shooting major motion pictures, not physically shooting them, but being involved with them. And I found that the use of video is an extremely powerful tool to teach and to advise. So we started shooting lifestyle videos, and that is a video to tell a patient what to expect when they go to the doctor. how important exercise is, the difference between a protein, a carbohydrate, and a fat, because rank and file Americans don't know those things. And
No.
approaching the healthcare space is scary, number one, because there's so many nooks and crannies you have to follow through. So we try to create this video platform that we can send to patients, and we do that. We send it to patients that are on our service as a you might be interested in looking at this. It's not selling them anything. It's just advising them on things. So we're using that type of technology all the time in promoting, healthy lifestyles. But that, along with the ordering platform that we're working with a couple of companies on, and it is technology that's available. It's just got to be exposed into the bigger marketplace. And we have a pretty big reach into the podiatric and the wound care space and dermatology space. So we can expose those clinicians and practice types to that type of software. So it's something we're looking to absorb into our offering. So that's kind of the way we're looking at the AI space, as a vehicle to get to a solution, not as the solution necessarily, but the vehicle to get to the solution. Does that make sense?
Makes a lot of sense. Yeah, it does. It really makes a lot of sense. Now, you've only been in this vehicle for 40 days, so we expect to hear a lot of information and a few changes as things move on. I hope to have you back on here again. Is there anything else you want to say to investors before we open it up to some questions?
No, I think that we want to, we want to run our company the proper way, compliantly grow at an effective rate. Not, fast is not always great, but we believe that we've been down this road before, and so it's not really fast. It's just formerly travel roads, and we'll do fine in that arena. So I don't know if there's anything I really need to add. I think we covered the top 10, if you will. So yeah, that's I run the company, and that's I do wound care.
There you go. Keep it simple, right? So does anybody have any questions for Kevin Lamb, the CEO of UBQU? We're going to open up the floor for a few questions before we move on to our open mic session, where we'll chop up OTC stocks and due diligence with OTC method, Kiko stocks. Anybody have any questions?
I do have a question.
Sure.
So, I've been listening in, and it sounds like a hugely important business, and very excited that you're taking it into OTC markets, especially because it's really nice to see some investment in it. I know that a lot of people reached out when the space was originally announced, and had some questions about the capital structure.
Yeah,
Have you got any of those questions at all?
I'm not the one to address it, and there's not been any decisions made about next steps with the capital structure. Everything is posted in OTC markets is accurate. Will there be changes? I'm sure that we'll be doing some things in the future. There's been a big discussion about reverse split, et cetera, and I'm really not in a position to address that today, because that's going to be driven by next steps of the company.
Absolutely.
Keep in mind, he's been in the vehicle for 40 days.
Well, that's what I'm saying. Yeah, and that's why
a little fresher.
Yeah.
Yeah.
Okay.
I mean, our goal is to grow the business to, provide benefit to not only patients, clinicians, employees that we have here, and stockholders. I mean, that's our goal. And I believe we can achieve pretty monumental things over the next 3 to 5 years.
Well, I'm looking forward to seeing it. It's been a fascinating conversation, and we'll look forward to more updates now.
Yeah, well, thank you so much for the question. I appreciate it.
Yeah, of course.
Yeah. Hey, Kevin, I would like to thank you for coming on, man. I look forward to having a follow-up after you've been in the saddle a little while and gotten a real grip on the reins of how you're moving this public vehicle, because I think you're going to go a long ways.
Well, I appreciate it, and thanks for your kindness and the questions. And if there's anything follow-up you need, just you've got my number. We'll stay in touch.
All right, you got it, Kevin. Till then, have a blessed day, man, and I'll have you back on again soon.
Sounds good. Thank you, buddy. Bye-bye.